Hei Ahuru Mowai, Māori cancer leadership is concerned about the inequitable impact that the Queen's Memorial public holiday will have on Māori and cancer inequities. Disruption to planned care and services vary across the motu, with some regions cancelling planned care and services and others who will work through the public holiday. Nationwide, around 55% of all procedures set for today have had to be rescheduled. Dr. Nina Scott, co-chair of Hei Ahuru Mowai, Māori cancer leaders and public health physician no Ngāti Whātua Ngāpuhi Waikato, is with us now. Tēnā koe, Dr. Scott, thank you for joining us.
Kia ora.
Now, talk to us about the disruptions you're facing that could potentially impact or will impact your patients and what they require.
So all around the country, whānau who have had either a cancer specialist appointment or maybe cancer screening appointment or cancer surgery have had their appointments cancelled. And, you know, you may think it's one day, but this is huge because we've already got a massive backlog. COVID has put us into a really unfortunate position for lung cancer treatment. We have 25% less lung cancer surgeries for Māori currently than we did a couple of years ago. And as lung cancer is the number one cause of death for Māori and avoidable death and cancer death, it's a massive issue, and we're really concerned of the impact of this one day, because you can't just put people onto the next day, because the next day's full up, the next week's full up. We're already working after hours. We've already got weekend clinics, so this is big.
And what kind of numbers are we talking about here?
That's part of the problem. We don't actually know what the numbers are. We haven't been able to get an idea of which services are going ahead, which are cancelling, because people are either having to cancel a whole list or keep the whole list going. So it's a huge logistical exercise, and I don't think people knew up until the final hour whether they could go ahead in many cases. So we don't actually know what's going on. We don't know the numbers. We don't know the impact on Māori, but we are concerned that the impact is going to be greater on Māori, because we're more likely to get those cancers that require really quick treatment. Like lung cancer, you need to get in fast to be able to survive. We can't, a week makes a difference in many cases. So I think it's going to have a bigger impact on Māori,
Generally with specialist appointments anyway, it could take weeks or months even before you can get to see specialists. But we were given 2 weeks' notice for this public holiday to remember Queen Elizabeth, but there are obviously downsides. How complicated is it then to simply reschedule?
Yeah, it's very complicated, because if like my colleague Dr. Max Ronald, who's a general surgeon and who should ideally be speaking with you today, is in theatre because she's decided to keep her theatre going. She's one of our leading Māori cancer surgeons, and so she's working today with her team to keep things going. But that's obviously required. People have had to find childcare and all of that kind of stuff, and give up their holiday. I don't know if they're going to be paid or not, but they're really keen to keep going, because they know the impact on their whānau. But for those services who couldn't stay open because for many different reasons, then rescheduling patients into the cancer screening, the tests to see if you do have cancer, and then the treatment to treat the cancer, whether it be surgery or other kind of treatment. That's a huge exercise, because there's no space. So they're going to have to move other people. It's going to be a ripple effect right throughout the whole system. So people are just going to have to be waiting, and then of course you lose people. Yeah. So we have a fantastic team here in the Waikato who a Māori hospital team who they're a whiri, they call themselves the whiri team. They find people who've been lost in the system for waiting for urgent appointments. So often there's a 10 strikes and you're out rule. So if the booking clerks try and ring you 3 times in one day, that's 3 shots. Then you can get a letter and some more phone calls. And if you're not contacted, then you drop off.
Okay.
So these guys go and find those whānau and do everything they can to bring them back in. And often it's really complicated. So whānau, the impact of poverty in the last few years means that people can't afford petrol to come into their hospital appointment. Sometimes they need accommodation support, which they can't afford. So it's a huge team sorting out the petrol, finding some accommodation so that whānau can actually come in. And, it's a month of planning and then it's gone,
Sure,
It's
so
very
many
concerning.
challenges, right? So many challenges just for the one day.
Yeah.
So, Dr. Scott, what do you think needs to change so that we might be able to accomplish better outcomes for whānau?
We need to do a lot. I think the actual health professionals are doing all they can. They are concerned. It's at the systems level, at the decision-making level. And we need, we've got a massive network of Māori hospital specialists who know what the issues are and they know what the solutions are, but they're not in those decision-making positions. We need to move Māori up the system into those decision-making positions. So, for example, that we can have more after-hours clinics. We can sort out these 10 strikes and you're out rules to get rid of them. And increase access to petrol vouchers and accommodation support.
Yep.
Start prioritising Māori into theatre lists and make sure that we prioritise whānau with those really urgent cancers that need treatment really fast. I think we need a cancer screening recovery plan from COVID because we're thousands of breast screens down nationally around the country. There's a whole lot of issues there. And sometimes you need to prioritise because, Māori we've got a 21% higher incidence of cancer, but we're 72% more likely to die from it. We need to get rid of that equity gap, and that means we need to prioritise Māori into treatment along and into investigations.
Well, given the struggles and challenges with increasing backlogs and rescheduling and so forth, what can whānau do to help support screening or treatment of patients?
Whānau can just do what whānau are already doing, which is, awhi and aroha, and support their whānau members to get to where they need to go. And keep phoning. Don't give up if you think you've got an appointment and you're waiting for a letter. Just keep phoning.
Beautiful. Look, really appreciate your time
today. Go back to your GP.
Yes, absolutely. Dr. Nina Scott, co-chair of Hei Ahuru Mōwai, Māori Cancer Leaders and Public Health Physician. Thank you so much for your insights today. Really appreciate it. Ngā mihi.
Ka kite.